uh, Kidneys part 4, the medications. So let's go over some of these meds. We have three types of diuretics that are used very frequently. We have the thiazide, which is hydrochlorothiazide, the loop, which is Lasix, and then the potassium sparing, which is spironolactone or aldactone. Um, the S for sparing and the S for spironolactone. The goal of all three of these is to diurese the patient. The loop and the thiazide, however, also secrete potassium, so we monitor potassium levels before administration. If the potassium level is low, we might need to hold the medication and call the MD. If the patient's potassium is chronically on the lower side, the MD might add either a potassium replacement or they might lower the dosage of whichever one of these they're getting and then add the potassium sparing diuretic in. Because this is a diuretic, but it does not excrete the potassium the way that the loop and the thiazide do, so it helps retain some of the potassium. So sometimes it's just decreasing the dose of the loop or thiazide and adding a smaller dose of potassium sparing, and sometimes the patient's potassium levels will equal out. So these medications, although are to diurese, and so this whole process will decrease our blood pressure. So monitoring the blood pressure prior to administration is a priority for this patient and for safety. So if the blood pressure is, let's say, 110 or below, then you might want to hold the medication and call the MD. That is also going to be dependent on what the norm is for the patient, what their normal systolic blood pressure is. So it's going to vary slightly, but always err on the side of caution. Always be that prudent nurse when it comes to these medications. We can also cause some dehydration, so we want to monitor the kidney labs, and we want to monitor the heart rate as well, because increase in heart rate can indicate dehydration. We need to educate the patient on an additive effect that could happen. They might be on other blood pressure medications, not diuretics, like a calcium channel blocker, a beta blocker, ACE inhibitor. And so those medications in conjunction with this, if this is new to their medication protocol, will just exacerbate that low blood pressure. So you need to educate them on safety with taking a new medication that decreases blood pressure. Talk to them about home blood pressure monitoring, and also talk to them about orthostatic hypotension, especially getting out of bed first thing in the morning and so on. Okay, all for safety reasons. Now, I'm going to tell you something that will also be, we've already spoken about it, that these medications are not given to patients with kidney failure that are anuric, that do not urinate, because that would defeat the whole purpose. This works on the kidneys to get rid of urine. So if it even works, because maybe the kidney is working or not, it could actually exacerbate the problem. Okay, so now let's go into specifics. Almost, come on. Oh, I'm clicking on the same one. Okay, here's my problem. Oh, no, there we go. That's right. I was right the first time. Okay, so thiazide diuretics, hydrochlorothiazide, very common. It's the first choice diuretic. It's fairly mild. It is used for both hypertension and kidney disease. Works on that distal convoluted tubule that leads to a loss of sodium and potassium. Apart from the similar side effects and items to monitor in the previous slide, we also want to encourage foods high in potassium. If your patient is on digoxin, this is a biggie with both thiazide and loop diuretics. If your patient is on digoxin, then we need to be worried about a couple of things. So low potassium, for example, which this can cause, and digoxin can cause dig toxicity. Also, dehydration, which this medication can cause, and digoxin can cause DIG toxicity. Okay, so we don't want to go there. So if someone is on digoxin and they're getting a fair amount of diuretics, apart from their normal labs and their potassium levels, we might want to ask the doctor if we can draw a DIG level as well, and pay close attention to that potassium level, making sure it doesn't drop too much or too fast. Another medication as well is lithium. So lithium levels can be grossly elevated when using a thiazide diuretic. So we want to monitor the patient closely and ask for routine lithium levels as well. Okay, that kind of just puts light on the fact that they're taking these medications and we're paying close attention to them. Loop diuretics. So furosemide or Lasix works on the ascending loop of Henle. Loop diuretic works on the loop of Henle. It is the second choice for kidney disease due to its increased strength in comparison to the thiazides. Blocks the reabsorption of sodium chloride, and it can actually cause acute kidney injury if it is a cause of, as it's a cause of dehydration as well. Goes for thiazide diuretics as well, but for this one, it is more prominent. So we need to watch for that dehydration, which would be a decrease in blood pressure and an increase in heart rate. You're at much higher risk of hypokalemia with this medication, and then, of course, along with that, you're at much higher risk of DIG toxicity. This can cause ototoxicity, so you want to have the patient let you know if there's any sort of tinnitus going on. And all of the safety precautions of blood pressure monitoring, heart rate, potassium, all go with this medication as well, if not more so. Okay, so potassium sparing diuretics, and you're going to see all these three types, very, very common. Spironolactone, so potassium sparing, spironolactone, that's how you remember it, otherwise known as aldactone, or triamterene is another one, but aldactone is definitely the most common. It blocks the effects of aldosterone, which then in turn excretes sodium and water and retains potassium, and that's what we want. We want that diuretic effect of the sodium of water being excreted, and we also want to retain potassium. So this is for someone that is on a loop or a thiazide and has low potassium, or maybe they just have a chronic low potassium to begin with. We might want to start them off on this medication, but it's mostly in conjunction with the loop and the thiazide. Even with the potassium being retained, we still need to monitor that potassium, as the patient could now become hyperkalemic. So we could actually go in the other direction. So we always want to monitor that for hyper and hypo, because maybe there's getting too much loop and not enough potassium sparing. So we need to keep the doctor aware of that. Sometimes he's in before the labs are drawn. Keep them in the loop. Get it? Loop diuretic. So this medication though really does work well for the patient that's on digoxin, as it helps retain that potassium and then helps prevent that ototoxicity. So I would say to know those three meds very, very well. And that will go for throughout your nursing career. Oxybutynin. So remember we talked about oxybutynin and it being an anticholinergic, and it helps reduce bladder spasms. So bladder spasms, that would be not very nice, right? Very uncomfortable, probably painful. It actually works directly on the smooth muscle by inhibiting acetylcholine. It has many side effects though, and we'll be visiting this medication again later. The ones I want to talk to you about right now are the most common side effects, which are drowsiness, constipation, dry mouth, thirst, and urine retention. So what anticholinergics do is they dry everything out. So you can see how urine retention would not be a good idea with someone with a UTI, as it could exacerbate that infection. And it's not always given for bladder spasms due to the risks. So it's really is a risk versus benefit. And it's really um, looked at closely before prescribing to a patient. Again, it is contraindicated though with renal obstructions because it is that smooth muscle relaxant, and we don't want that because we want to get everything out. So we need the muscles to work and monitor those renal and hepatic functions as well. So as you've noticed, some of these medications that we give for renal do actually cause some damage to, or can potentially cause some damage to the kidneys. So we always want to be cautious and with any medication, not just these, and monitor their renal function to make sure that any of the meds that we're giving them is not causing damage to the kidneys themselves. Pyridium is a urinary tract analgesic. It's very common, given out a lot. It is, think of it as a topical analgesic. If you put a topical analgesic on your arm for, something that hurts. But this is effect is within the bladder and the urethra, and it happens as you're excreting the medication. So you take the medication orally, and it goes through your system, and as it's coming out of your kidney system, it gives that topical analgesic effect, and it specifically works on the mucosa of the bladder and the urethra. It does cause a reddish orange kind of urine color, so patients can get quite disturbed when they see that if you don't tell them about it first. And so you need to educate them on that prior to administration. So along with the kidney labs and liver labs, you also have to be watched. They also have to be watched, sorry, because well, again, kidney, we're just going to monitor that. And also, it can slightly elevate the liver enzymes, this medication. So keep a close eye on that. But I expect all of you to monitor the kidneys, the electrolytes, the RBCs, hemoglobin, hematocrit, platelets, clotting factors, kidney and liver functions before giving any medications. So that's kind of standard policy. And then lastly, we have our bladder protectants. These are kind of neat. Pentosan polysulfate is a bladder protectant. It coats the inside, again, we take it orally, but then it coats the inside of the bladder as it's being excreted to that bladder wall mucosa, primarily for cystitis, because that is a UTI in the bladder. It helps prevent irritation from the solutes, because we'll have a lot of solutes from that infection, and so it helps from the irritation. It also has an anticoagulant property, which is good because it helps decrease blood clot formation in the bladder and in the urinary system, which is increased, has an increased risk when you have problems in the urinary system. So that is a good thing, but on the other hand, we also then need to monitor for bleeding and its effectiveness. So if any of these meds are not effective, as far as the oxybutynin or the pyridium or this bladder protectant, then if it's not working for the patient, there's no point for them to be on it. So you need to reassess and monitor that effectiveness. And if it's not being effective, then let the physician know so that it can be discontinued or maybe substituted for another product.